Okay, so in this video, what I wanted to do is basically just show you how I'm using AI mostly for physical therapy now. I've done a bunch of episodes on doing different biohacking, different modalities, training routines. But in this particular episode, I just wanted to talk about two different physical therapy things that I had issues with and to show you where I've had success and where that AI is still lacking. So take it with a grain of salt. This is not medical advice. Obviously, go see a professional. But for someone like me who's been in the business long enough and, I really don't want to pay physical therapists right now if I can try to nip this in the bud. This is why I've used AI and had some successes, and I want to share that with you. So not to bore my usual audience, but for a quick recap of new people, I've had a back issue that I've had for almost 8 years now, herniated a disc, actually popped the disc, had it cleaned out twice, microdiscectomy, insane amount of pain, had that surgery, fixed it, and now I've built routines and different practices, different therapies over the years that work for me. I'm still not 100% whole person, but I'm always struggling to find, you think I'm like at 93% if I had to pick a number, and I'm just always striving for that 100%, right? We all should. So just over the years of using AI, helping me fix routines, and then ended up going seeing physical therapists, ended up going seeing my spine surgeon, and basically, just to sum it all up, all the stuff that AI and all my physical therapists just have not gotten me that last little over the hump with, let's pick for my back right now. And hearing that Grok was a different type of AI that doesn't suppress information, especially in the biohacking world, medical field, as long as someone has done, even a little bit of a study, this AI system will pull it up when I guess, don't quote me, ChatGPT, Gemini, all those will suppress it because the studies weren't that big enough and yada, 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 right? So coming here to Grok and trying it, that's what I'm showing you right now. I've been telling it for my specific problem with my L5-S1. I've been using ChatGPT to help out with my lower back problems, but I thought I'd give you a try. Had surgery on my back. Now it's 7-8 years now. And having recurrence of my disc popping out the jelly center, had 2 microdiscectomies. And so basically I'm prompting it the whole last 7 years, and I'm happy with where I'm at, 93%, but I heard you were pretty good. Can you get me to that last little bit? And responses, it's got to seem human. I'm really sorry you're dealing with this. Here's some evidence-based things you should try to stack onto your current routine. Sleeping to a true side sleeping setup with proper pillow geometry. Talking about putting pillows in between my legs, getting a quality adjustable airbed or quality Tempur-Pedic mattress, doing your reverse hypers or prone press-ups, anti-inflammatory lifestyle, using traction, daily neural flossing. And basically I told it, I have a Tempur-Pedic bed. I have a program that feels good, that I'm basically trying to get to that 100% feeling again. And just to let you know, I'm just picking one aspect of trying to have Grok AI help me here, and that's basically sleeping. Because out of all my issues, I would say 98% of them are caused by sleep, just inactivity, being in the wrong angles, my knees not being up, whatnot. My back is getting inflamed. That specific disc or the muscles around it are getting inflamed for that long of a sleeping session, hopefully 8 hours. And I wake up in agonizing pain. Within 5 minutes, I'm basically feeling pretty good. And as long as I'm moving for the rest of the day, that's where I say I'm at like 93%. So I tell AI here, I have a Tempur-Pedic bed, spent a lot of money on it. I feel like I've got my routines all perfect. Most of the time I side sleep and I do my very best with a pillow under my knees, letting my back lay flat. I told it I feel when I side sleep, my hips and shoulders and rib cage become in line and a slightly bent spine, but it's so hard to keep that spine perfect in alignment. I'm telling it basically that in my theory, my head to shoulders to hips to knees to ankles, my spine needs to be perfectly linear. And basically Grok is telling me, no, you don't need that. So it says you're already at 93, 95%. That's great. Let's get you that last 5 to 7%. Truly feel 100% morning. Yes. First thing it says is I need to switch to a 0 gravity adjustable base. And you can read all this, but once my head at this 10 to 15% decline, and once my knees up on a 20 to 30% decline, still putting pillows under my knees while I'm side sleeping, then it's talking about belly taping and a couple different exercises to do before sleeping, which I have, I was doing a lot of stretching, especially my quads, and I felt that was helping. That kind of put me up to that 93% that I keep talking about. Then it's talking about traction, peptides, but its overall strategy here is get it on the 0G base. And I said, thanks, these are great ideas. Never thought about that. And just to let you know, the prone extensions or Cobra push-ups have always heard it. Jefferson curls have always been greater for me and have really helped me get to that 93%. So I said, okay, cool. So really basically you need to be on this zero gravity setup. So here's what a zero gravity bed looks like. Here's that incline where your head is, your hips and hamstrings are kind of in that indent on the bottom, and then your knees are propped up. So this is a different way of sleeping. And especially my biggest problem was, okay, I don't mind sleeping like this on my back, but what about side sleeping? It just basically crunches you into almost a V shape. And it is very uncomfortable when you first start out, but it's supposed to ease neck and back pain, improve digestion, whatever. I really just wanted the pressure on my L5S1 being released, and it swore that this would work. And it did. So I said, that's a bit expensive for me to get a bed like this. What can I do to do this kind of DIY? And it basically just had me buy some wedges. They almost look like sex pillows, but just off of Amazon, get a wedge for your head and then finding a knee bolster pad. And I think I got each one for $30 each. So instead of paying for a $3,000 new bed, I got this all for $60, and 100% took me from 93%. And I'm now like at 98. So already telling you that Grok, out of all these years of me using AI, Gemini, ChatGPT, Grok solved it with its first recommendation. And I'll tell you, with biohacking and the health and wellness field specifically, Grok has been crushing all the other different AIs. It is sucked with other aspects I do, with image generation, sounding more human than some of the other ones. My wife uses more Claude for her business and marketing consulting. So definitely got to pick it which AI, but so far Grok has been killing it. So long story short, doing the zero gravity sleeping, like I said, actually worked. And the reasoning behind it, I couldn't even find it in this long thread of using Grok, but basically having my head and shoulders on that incline, that 10 to 15% incline with my knees up, creating that V formation for my hips, even when I'm side sleeping, it still wants me to be in that uncomfortable position because of the release it gives basically on that L4 to L5, L5 to S1. No matter what angle you're putting it on, it's just taking the pressure off of it, which is relaxing the muscles that are causing all this pain. I'm always going to have this problem because I have a burst herniated disc. And until I get that either fixed or fused, this will always be a continuing issue for me. But to take me to 98%, and I've got all my other routines for exercises and physical therapy, this is unreal. Okay, switching gears. Now, my other issue I had that I wanted to test Grok with, and like I mentioned, I've been all different types of overall health questions, biohacking, my fasting routines. Grok has been killing it versus ChatGPT, Gemini, or Claude. So I said, okay, let's give you another go. I'm having problems with my knees. I'm 45. I attribute some of my knee problems to age. I was never a runner, but personal trainer, did a lot of different exercises, and all of a sudden my knees are hurting. What do you think? And basically just said, it's first things that we're talking about is your VMO, which is a long, lengthy name, but it's basically the muscle, the thicker one right next to your knee on the inner part of your quad muscle, close to your knee. And basically, I've been doing a lot of more time under tension, which if you've been listening to my podcast, that I practice that mostly because of my injuries. And I feel like for the over 40 crowd, just a better bang for the buck for risk versus reward on building muscle, the least amount of injury. And basically, Grok is saying that because I do that, that is a weakness to the patella and the muscles around the patella, your kneecap, of doing this style because you're doing so much time under tension versus the old method of, quicker but heavier, which has its problems, but this is a new one. So I get it. You do different modalities, pros and cons to everything, right? So then it's talking about loss of knee extension, strength, end range control, foot ankle restrictions. So what's going to move the needle on this? Basically, it gives me a list of exercises to start trying out: Spanish squats or belt squats, Poliquin step-ups, tibia raises, and running backwards on the treadmill. So after a couple of weeks, I told it I was still having problems. Is there any things you can actually test me on to make sure we're going down the right path? And it said knee tracking was a big one. It was asking me to feel my contractions of my VMO during different exercises, so I did it. And basically, it gave me some adjustments to do, some that go after my hip abductors, external rotators. So it gave me these sideline clamshells, monster walks, single leg glute bridges, wanted me to modify my Spanish squats and add in a heel elevated goblet squat. So once again, long story short, I do this for about 2 months, maybe 3 months. Maybe my left knee is getting better, my right knee is getting worse. And Grok had pretty much said that I had PFPS, which is like a patella syndrome. Basically, they call it runner's knee. And kept giving it more input. It was giving me more modifications, but still kind of sticking with the same types of exercises. And my right knee was getting so bad, I said, okay, I have a trip to Huntington Beach where my physical therapist that I trust is. Told him I was coming, saw him, spent an hour and a half with him, and basically said, yeah, it looks like PFPS or runner's knee. However, after doing this due diligence and checking everything, basically saw that my IT band was extremely tight and knotted up. My quads were extremely knotted up, which I kind of knew and wasn't really focusing on stretching those. He was definitely going after my hip abductors and all the muscles around there. So Grok was right on that. So I told Grok, I had my therapist looked over, basically said the same thing, runner's knee or PFPS, possible ligament damage, but we didn't want to go that route until we did all these exercises, and it worked. And my therapist had me doing a lot of foam rolling on my quad IT band, using a TheraBand around my knees and doing side steps around in a circle, and then doing single leg calf raises while knee bent, while slightly leaning forward. There was a couple more exercises, but those were the main ones. And I'm telling you, after I spent an hour with my physical therapist, my knee pain was gone for like a week, and then slowly started coming back because it took me a while to get in the routine of adding those exercises in. And sure enough, knee pain absolutely gone within like the 2 to 3 weeks after seeing my therapist. So here I am telling Grok this exact thing. How come you didn't catch this? And what Grok said was basically, I was focusing on the distal VMO muscle, that thicker muscle on the side of your knee, on the inside of your knee, which it says was attributed to more someone doing time under tension like me. That would be possibly a muscle that wasn't getting activated and then just slowly cascade into other problems. And maybe that's how it started. I don't know. And it did give me some testing feedback, and it was just really going after the VMO isolation and strength building. And all it did was apologize that it didn't emphasize foam rolling or exact bent knee, soleus raised enough. And here's my main point to this whole episode is, had I prompted AI, or Grok being the better one for like what I'm saying, had I prompted it with, I want more tests, just give it more input, I'm pretty confident that it would have at least gotten a couple of these things caught, because I would have given the input like, oh my God, my IT band hurts so bad when I foam roll it, or it would have caught something wrong with my calf. And it basically all kind of stems into referred pain into my knee. And so in conclusion, obviously AI is still not there where it's going to take the place of an expert. If you can afford it, if you can get the access to information from an expert, probably is the best. But like I said, not all of us can afford it. So find yourself a good physical therapist is really the moral of the story. But don't be afraid to use AI to kind of help you. I think it's low risk because a lot of the exercises it has, even if it doesn't fix your problem, none of these exercises hurt you. They only help strengthen those individual muscles or ligaments anyways. So you doing them improperly probably would be a problem. So hopefully you have a good source on YouTube or social media of an actual therapist showing you how to properly do these, or you have a personal trainer. But like I said, I'm not giving medical advice. I'm just saying AI has its pros and it has its cons, but I'm still optimistic that, educating myself and prompting it better, I'll probably get better results on it. But in the end, you got to have some experts to have a check and balance system as well. So very cool. I love this guy. He's only local to Orange County, so you might have to find someone on your own. I think I'll conclude with that. And thanks for listening, and I'll catch you on the next one.